Hi, I'm Dr. Duke, and this is Run Smart New York, your turbocharged sports medicine approach to preventing running injuries. And today, we're back with Lottie. She's a local runner, and she's an expert foodie. You have to check out her Instagram. It's called Running on Veggies. Anyway, today's little session is on the lower back. How do you stretch out the lower back? So, when most people stretch out the lower back, they do what, Lottie?
They just bring in their knees and rock back and forth.
They bring in their knees, they rock back and forth. You know what? This is horrible. All it does is put compression on the lower back. It can protrude a disc that's already injured. But worse for runners is that it's cramping up the hip flexors. This isn't doing anything functional. Show them how I taught you how to stretch out the lower back.
So I lie on my side.
Lay on your side, pull your leg all the way up, drop your foot off of an elevation. You could use a bed if you don't have like one of these tables, and then rotate onto your stomach. Beautiful. When you do this stretch, now what's happening is that it's a very effective, safe way to stretch out the entire paraspinal muscles that run up and down like railroad tracks. With the leg off the table, now you're getting a stretch down your IT band and to the tensa fascia lata, the origin of the IT band, and to something called the quadratus lumborum. Quadratus lumborum is a hip hiker. It's like something that kind of hikes the hip up in the air, and when you run in the same direction, that muscle will shorten and shorten and shorten, and like you're never stretching it out. And you have to, otherwise you're going to end up getting a functional hip drop. Where else do you feel that, Bonnie?
Definitely all through here.
All through there. That is the abdominal obliques. So the abdominal obliques are a protection for our lower back. And when they get short and tight, you start getting all hunched over like a turtle. You have to do this stretch, and you have to take a solid breath when you do this stretch. So breathe in, because you get to the rib cage and QL. You're also going to get to the abdominal obliques, spinal erectors. That's a stretch. I'm Dr. Duke. This is Run Smart New York.